I'm Chase Chick with Pursuit of Happiness, and today we're going to talk about the difference between bipolar and major depression. The problem is that depression is half of bipolar. What does that mean? Well, in depression, people feel depressed. They have trouble sleeping, have trouble eating, have trouble concentrating. The prominent symptom criteria of major depression, though, is feelings of sadness.
A time to pluck up that which is planted. A time to kill and a time to heal.
Now, in bipolar, you have the component of major depression, but you also have the component of mania. This is where it becomes a problem, because people wait until they're depressed, the not fun part, and then they come into the clinic and they tell us all about how they're depressed. And so that makes us think that they're depressed. And they are depressed at that moment. But the trouble is that we'll start treating them for a disorder which is not what they have. And this can be problematic for a couple of reasons. The first reason is that because if they go to see a psychiatrist and the psychiatrist believes that they have major depression when they actually have bipolar, the psychiatrist is likely to prescribe them an antidepressant. Now that's going to help in the short term while they're depressed because it'll help them feel better. But once the bipolar patient begins to cycle up into their manic episode and they're on antidepressants that are pushing mania, basically, their manic episode could get way out of control.
Hey, baggy eyes.
And that's not what we want to do. We don't want people making even riskier decisions than they would normally be making in their usual manic episode. We don't want people experiencing any more mania than is necessary. So that's why it's dangerous to prescribe a bipolar patient antidepressants. A good mental health counselor will properly screen for episodes of mania throughout a patient's life. This is very important that the counselor does this, and a good counselor knows to do this. Now, it's important as a patient to make sure that you are as honest as possible about your history. If you've had an episode of mania, we need to know about that because that will color our disposition for your diagnosis. These subtle differences is also why people should be very cautious of self-diagnosis. They should also be very cautious of letting people who are not properly trained diagnose them. And I realize that a lot of people trust their family doctor, and I realize that a lot of people trust their pastors and their priests and their teachers and their school figures and other figures of authority and whoever else. It's very dangerous to let those people who don't have training in psychiatric disorders diagnose people with psychiatric disorders.
It's rock, dude.
10-4.
Hey, dude, I think that dude wants you.
Well, that's just the pilot.
Dude, you're not the pilot?
No, I've never done this before. But I did stay at a Holiday Inn Express last night. Whee!
A mental health professional is going to know to look out for a variety of things. So like take ADHD for an example. There's symptom criteria that could be caused by head injuries. It could be caused by autism spectrum development. It could be caused by drug abuse. It could be caused by any number of things, and a mental health professional is going to know and have the proper training. Be able to screen for that type of stuff so that we don't make a misdiagnosis. Misdiagnosis is one of the worst, it's the worst thing that we can do as a mental health professional. And it's one of the worst things that can happen to you as a patient. So make sure that A, you're not trying to diagnose yourself. That means either seeing a licensed professional counselor, a MD psychiatrist, or a PhD psychologist. Those are the three main guys that you should be consulting if you think there could be the presence of mental illness.